Well, welcome, everyone. This is Jeannie White, station manager at Passionate World Talk Radio, and today I'm the producer of this show. And it's going to be a very interesting show, and it's with Sheila Wilson, and you've heard of Sheila before. She's been on this show many times, and it's to do with her Stop Healthcare Violence. Well, welcome, Sheila.
Thank you, Jeannie White, and hello and welcome to everybody that will be listening to our program, Stop Healthcare Violence, on the Passionate World Talk Radio. Thanks again, Jeannie, for doing this. Stop Healthcare Violence started in 2008, and I became the president of Stop Healthcare Violence in 2009. We became a nonprofit in 2019. Our mission of Stop Healthcare Violence is to educate and inform the public on the alarming epidemic of violence committed against healthcare personnel. We also provide support and advocacy for the victims and lobby for legislative change. Tonight I'm going to interview a nurse that has been assaulted, I don't know how many times, by the patients that he works with. And I'm going to let him tell you his story. Hello, Mac. How are you?
I'm doing very well, thank you, Sheila.
And you are a nurse?
I am.
And how long have you been in nursing?
I've been doing nursing for about 17 years.
Wow, that's pretty good. And do you find that nursing has become a little violent at all? Do you get assaulted by patients?
Unfortunately, we do, and it's really kind of an everyday thing. And I think the excuses that are kind of given toward it are that, people are in crisis and they really don't know what they're doing, so it's more or less excused. But every day.
Every day. See, many years ago, I did a little show with I think it was NEOSH. And it was like a 1 minute and 30-second show about we need to change the idea of making excuses for our patients. Because we do. We got into this habit of saying, they really didn't mean it. He said he was sorry. He didn't mean to slap me around. And then we never went on to make out incident reports or anything else. And it's still going on till this day. And this was probably 10 years ago I did that. Do you make out incident reports where you are? Are they looked upon as being good, bad, or indifferent?
Yes, we do incident reports. They're considered learning tools for everyone involved in the hospital. So, yes, definitely.
That's good. Do you get a good positive feedback from your facility?
From my facility, definitely. Otherwise, no one would really be able to stay at work, to be honest with you. So the incident reports are treated very seriously.
That's good. Now, do you know, and I don't know, I wasn't going to ask you this, but did you ever get involved with OSHA?
Not to my knowledge. Not that I'm aware of.
Yeah, I was wondering. A couple of times at a hospital that I had worked at, we were getting assaulted and lots of things were going on, and we had called OSHA. And they come in, but not a whole lot was done that we knew about. So I was just curious. That was something. Now, do you know, in the listeners, that the Mass Nurses Association and the Emergency Nurses Association did this through surveys that 70 to 80% of healthcare providers get assaulted in our line of nursing. And I believe that you find that's true, because if you folks get assaulted many times during the course of the day, that's tough. How do you deal with that?
Well, nursing, not to sound corny, is work from the heart, and you can overcome a lot when your heart's involved.
Well, that's true, and I think this is why we allow our patients to give excuses, and we agree with them. We don't make out incident reports, but you said that you do. Or where you work, everybody does it. Where I worked, very few of us made out incident reports because we allowed them to do it, and the culture became part of the job. And that's not what we wanted, and that's not what we should be doing. Did the person that assaulted you, this is a big thing about, did that person know what they were doing to you when they assaulted you?
Absolutely.
And so how did you handle that?
Well, the patient wasn't even my patient. I just happened to be, I was in a hurry actually to go to a patient that was in need, a patient that was what we call failure to thrive situation, and required a lot of my attention. And I was trying to hurry to that patient. And as I was going there, I noticed a female patient, a young female patient, was seated watching TV with another male patient, and they were kind of playing footsie, so to speak, and that's not tolerated in any way, shape, or form. I mean, for all I know, that could have been that male was being aggressive towards that female, and she didn't know what to do. You'd never know what that is. But so I had to stop what I was doing, and I essentially sat down with the two that were there, and I had to explain that this wasn't tolerated, this behavior. And the person that became aggressive was the female, and
wow.
I didn't expect that, to be honest with you. I went and I called for help from a female nurse, so that there wasn't a problem there where I'm a male and that patient was female. As I was doing this, that female saw that as an escalation, and she came running right at me and grabbed me by the collar of my shirt and began to swing punches at my face. And all I could really do was just stand there and kind of take it, because I couldn't get away from the person. She had a firm hold of my shirt. It was really kind of a scary situation. I was kind of embarrassed too that I let myself, get into that situation. But essentially, the other nurses and staff came to my assistance, and they were able to separate the person from me, and we had to separate the two and call security, and just kind of quell the unit down, and just kind of sit down and counsel these people on the rules of the road. But in the meantime, I have a torn shirt. I had bruises on my face, scratches on my chest. I mean, it was awful. I actually left the unit because I was just out of sorts. I needed to collect myself before I could come back and be effective again. I never did get to my patient. I never got to my failure to thrive patient, needless to say.
Well, this is what happens to all of us. Excuse me. When you get assaulted, a lot of times it's so unexpected that you can't. You need to get your bearings again. You can't function. Could you have gone home?
Well, no, because then that would make the load on the other nurses too great to continue. So I had to stay.
So you had to stay. Did you take any time off?
The only thing that I really did was another staff was called in. That person came about an hour later, and I went to be checked out, medically, to make sure that I was okay. But no, I took no time off.
Yeah, see, now where I had worked, you can take time off if you get assaulted. I don't know what it is now because I haven't worked there for a while. but it's and there was no real questions asked. You need to do self-care when you get assaulted like that unexpectedly. Usually when you go into a patient, you can have that sixth sense of this one. I have to watch what I'm doing, but it sounds like you went over to this two people just to kind of tell them a couple of rules, and then this one kind of exploded on you. Is that what happened?
It's exactly what happened.
And that's what a lot of nurses are out because of anxiety issues, because of stuff like that, and PTSD. And sometimes, you really need to do a lot of self-care for yourself. Do you are you able to do that? I mean, do you do any meditation or anything along that line? To
be honest with you, I go to the gym, and I just try to kind of work out hard to just sort of get rid of any built-up anxiety that I have.
That's awesome.
And I do talk amongst my peers to figure out a new plan and a new way of managing things. But like I said, also with those reports that we do, the incident reports, those essentially become training tools, and so there is follow-up. But there's as far as it's an assault, but it's an assault that's essentially not considered an assault.
And why is that?
Well, I really, that kind of befuddles me, to be honest with you. I mean, as far as I'm concerned, you can walk along the sidewalk near a hospital, and if I assault you on the sidewalk outside of a hospital, I'm charged with assault and battery. But as soon as I walk through the front door of that hospital, that's no longer assault and battery.
Right. I went to court with a woman that was really damaged by a patient that she had already known, and she brought him to court, and the judge basically told her that, I know that your family wants him in jail, but I don't think he hurt you with your name in his brain. So I don't know if that he was saying it was premeditation if he had her name in the brain, but he gave him all these rules. He had to go to probation, and then he had to send her a letter via the hospital address. Nobody knows if he went to probation. She never received a letter. And she was so angry because he should have been in jail. He should have been punished for his behavior. And he never was. She ended up not being able to work in the same place that we were working. She went to 2 other units, and she had so much PTSD that she couldn't continue. And that's just not fair. But you say to yourself, well, if he didn't know her name and he just assaulted her, well, then does that mean that I could go into a liquor store and shoot somebody? I wouldn't know their name. Would I get off with just probation? Does that make any sense at all?
There's so many talented nurses out there that are not working in a hospital for the reasons that you're speaking of. It's just it's a place for the young and the folks that haven't been assaulted yet, type of thing. There's just so many people that could be working in a hospital and could be offering so much talent to someone's care that aren't there because of this tolerated behavior by patients.
Right. Now, Mac, do you have security guards in your place?
Yes.
You do. Are they hands off or hands on?
They're hands on.
Oh, they are. I have heard the place that I used to work is now hands off, in one of their satellite places is also hands-off. And I'm just trying to get an idea why that's important. I mean, I understand somebody said that there was a lot of lawsuits for the hospitals if security guards ended up putting a person down, and they could get sued. So I'm just kind of curious. And you did say that your facility supported you. That's absolutely awesome. That really is. Now, I'd like to ask you one last question, unless you have something else to say.
Okay.
All right. Do you have any solutions on how to stop the healthcare violence?
Well, I think the one major thing would be is if our local governments saw these instances as assault and battery as they are. If a lot of people that know what they're doing are assaulting healthcare staff, and they know there's no consolation to their actions. And I think if they knew that there was a law in place that would punish them, or at least take them to a point where they needed to answer for what they did, you'd see a sharp decrease in all of this, I think.
Well,
something needs to be done.
Right. I don't know if you know, but Jeannie White and myself have been up to the Boston State House, and I think the guards are going to start calling us by name. And the last bill that M&A put through to make it a felony law in the state of Massachusetts was sent to study, and that means it's dead. They're not going to go through it. And what we found out is that, they were concerned about the cost, and nobody really said to me exactly what the cost is. Then they were concerned if a person goes to prison with a felony charge, when they come out, they may not be able to get a job. But we're forgetting about the victim here, the nurse that was assaulted, or the x-ray tech that's in a locked place because of the radiation, and she's assaulted, and or the medical assistant, and it was just kind of, and they're afraid of the mental health situation. They don't want to put somebody in prison that has a mental health diagnosis. And kids at 3 years old are now put on attention deficit medicine, which is in the DMS, 5 or 6 now, for the diagnostic psychiatric conditions. I mean, how do you rule against any of this? 36 other states have it as a felony. I don't know what Massachusetts is doing. Do you have any thoughts on that?
I think I've pretty much said what I believe is a solution. I just don't see how people can get away with what they're doing. Like I said, I've seen a lot of talented people move off into, doing at-home care or other care than an acute care hospital setting, and it's actually hurting the care overall because you have so much turnover.
Right.
So it really, if you care about healthcare, care about the healthcare staff.
That's right. That's right. Well, I think I'm going to say thank you, Mac, for joining me tonight. And unless you have any other questions, I would like to say thank you all for listening, and we can end our program.
Well, all right.
Do you have any other questions? Oh, okay.
I'm just going to say thank you very much to the both of you for a very interesting show. This is Jeannie White from Social Connections. Oh, okay. This is Jeannie White from Passionate World Talk Radio, the station manager here. Social Connections is another show that I do once in a while. So thank you. I gave myself a little plug, I guess, Sheila. But so anyway, thank you, Sheila, for a very interesting interview as usual every time. Thank you, everyone. And you will be able to hear this on different pieces of social media, and I will also be giving off a blog that I post in numerous podcast areas. Again, thank you for listening. Everyone have a good time, good night, and Sheila Wilson will be back again at another time and have another discussion. Thank you, everyone. Bye now.